My name is Andrea Weiner. I'm the Deputy Director of the Association of Healthcare Journalists. Thank you guys for joining us today. We're going to talk about our two of our biggest fellowship programs, our U.S. Health Systems Reporting Fellowship and the International Health Study Fellowship. This is our live Q&A session. If you come up with questions, put them in the Q&A function. And Kelsey Ryan, our executive director, is also on the call, and she'll be able to answer those, or we will bring them up during the session to be able to chat about that. So let's go ahead and get started. So welcome and introductions. Like I said, my name is Andrea Weiner. Kelsey Ryan, our executive director, is on the call, and we've got some other teammates that will be joining the discussion soon. So what we are is the Association of Healthcare Journalists. Our goal is to set new standards for reporting healthcare and covering all of the things that are associated with our health system. There is so much going on right now. And one of the ways that we do that is through providing professional development opportunities, which can look like a number of things. But in this particular moment, we are looking at our fellowships that we offer. And so these two fellowships, like I said, are some of the biggest fellowships that we have, and the longest lasting. So we believe in accurate, contextual, and balanced healthcare reporting. We think it's more important than ever, and I'm sure you're aware of that too. There are people who depend on healthcare stories to make life-altering decisions every single day. And you've made it your work to keep the public informed about some of those decisions and those important topics through thorough and fair coverage. And we're proud to partner with you and other journalists who take this responsibility so seriously. Our next slide, these are the two fellowships we're talking about today. These are designed to spark curiosity, expand your horizons, empower journalists to tell the stories that truly matter. The U.S. Fellowship launched in 2011, and it opens the door for journalists to immerse themselves in healthcare reporting in ways that transform their careers. So we build on that success. We launched our International Fellowship Program in 2019, which gave reporters the opportunity to explore healthcare systems around the globe and bring back insights that resonate with audience at home. So even with a brief pause during COVID, nearly 90 journalists have already taken part in the fellowship programs that I've mentioned. Each of them have come back with fresh perspectives, powerful stories, and a new and renewed sense of purpose for their reporting. The U.S. Health System Reporting Fellowship is a year-long fellowship for supporting big reporting projects. This is where journalists can pursue significant reporting project related to the U.S. healthcare system at the local, regional, or national level. This fellowship allows mid-career journalists to maintain their regular employment while working at a major project for over a 12-month period. It's a calendar year. The International Health Study Fellowship is a slightly shorter fellowship. It's a 6-month fellowship focused on comparing the U.S. healthcare system to its global counterparts. In the past, this fellowship has been limited to European countries. Last year, we went to Japan. This year, we are focusing on the UK and France. And notably, 93%, actually, I think the percentage might be a little higher now, but over 90% of AHCJ reporting-based fellows remain in journalism after their fellowship is complete. This really underscores the lasting impact of these programs on your career, their career, and the health journalism field at large. Bear with me while I switch slides today. So this is, like I said, we talk about issues with the U.S. healthcare system. They're often obvious to folks, from large swaths of uninsured residents and junk insurance plans to high maternal mortality rates and preventable medical errors. But what's at the root causes of issues like this? What might an equitable healthcare system look like? These are all things that you know as journalists, and you may not have an opportunity to dig into in your day-to-day reporting. But with this fellowship, you have the opportunity to dig in and focus on the U.S. healthcare system, performance, the quality, access, equity issues in your community, and like we said, state, regional, or national. So we have the criteria, it does require you to be a US based journalist. This is simply due to funding limitations. So if you're applying for this program, please make sure that you are a US based journalist. Come with your proposal of your project and the things you want to cover. And then we will review things. I've got a timeline coming up that we'll look at. And then you'll get paired with a mentor in this program, and this allows you to explore those things and ask questions of what we can do to push your reporting further, what areas you might be missing. So the eligibility, like I said, must be a US based journalist, working journalist who qualifies for our professional level membership. If you're not sure if you qualify for that, visit healthjournalism.org. In the upper right hand corner, there's a become a member option. And there is where you can view what the requirements are to be a membership at the professional level. We want you to have several years of experience in health reporting. Like I mentioned, this is not necessarily a reporting fellowship for a new journalist. This is somebody who is established. This is kind of your pinnacle fellowship of your career. And another important piece is we really require you to have the support of a publishing outlet. We know that as freelancers and independent journalists, that can be hard to tackle, but that is a requirement for application. You must submit a letter of support that agrees to not only support you in your work and taking time to do this project, but also guaranteeing that the project will be published in that publication. So, as part of our selection process, we have a committee that will review each application as it's submitted. I know you guys are journalists and you're focused on deadline, and some folks like to wait till the very last minute of a deadline, but we really do encourage you to try to apply early. We review our applications on a rolling basis. And then applications will be scored using a matrix of selection criteria. And we have some more details in slides that are coming up. So, what is covered by our fellowship? This, again, is for the U.S. Health Systems Reporting Fellowship, which includes seminar trips, including food, lodging, and travel within the United States. As I mentioned, you get a mentor as part of your project. You get a project allowance of up to $2,500. That money can be used for field reporting trips, data purchases, other approved research expenses as part of this process. The fellowship also includes attendance at the AHCJ annual conference, and that includes travel, lodging, and registration. You also receive 1 year's professional membership in AHCJ. That's a $60 value. And of course, we would love for you to stick around as a member even after your fellowship is done. Our alumni network is broad and vast, and we like to include you in that. And then lastly, a $5,000 fellowship award for the successful completion of your project before the end of the calendar year, that formal project period. All right, let me move on here. For our timeline, we have our deadline is September 25th, is our application deadline. Fellowship Selection Committee is going to review applications in October. In November, we plan to notify you of your application status. And I just want to let you know that, as I said, we are reviewing these as they come in on a rolling basis. And so, our application deadline is September 25th. That may be that we decide rather quickly after that. We are trying to make our decisions mid to early October. And then if we need to, we can expand that and let people know. Next, sorry, I had some chats coming in. Next, we have December. We plan to announce the fellowship class. We get some time for you to get approvals from your network, for us to write up a press release, get headshots, that sort of thing in. And then in January is your first fellowship orientation seminar, and that is in New York City with the rest of the fellowship class. And then in spring of 2027 is where you go to the next conference. I noticed a typo. Our conference is not HJ 25. It'll be HJ 27, which will be on the East Coast in spring of 2027. And then in the fall of 2027, you have your third and final seminar in New York City. And I am going to pause for a second here and let in some more folks. Let me let in Emily. We have Emily here, who is one of our fellows. And I am going to put her in here so she can talk. Emily, I have just let you, Emily Brindley, I have let you in here as a panelist that she'll join here shortly. Emily is one of our previous fellows, U.S. Health Systems Reporting Fellows, and she'll share once she's on, be able to share some information about her project, which was investigating why Texas hospitals report hundreds of surgical errors each year and whether patients can obtain justice under the state's strict medical malpractice laws. Emily is with the Dallas Morning News and is currently a fellow, wrapping up things now. But Emily, I turn it over to you for anything you might want to share about your experience with the fellowship. Thanks for joining us.
Yeah. Yeah, thank you. Happy to be here. So I am currently a fellow, so I haven't actually published most of my project yet. It'll publish in a couple of months. But for me, I think this fellowship has been super helpful because of the structure that it offers. The funding is also great. I would never say no to more funding, but the structure is really the thing that I think has been the most helpful for me. I'm a beat reporter, a health beat reporter, not an investigative reporter by title. So having that like structured time and like structured goals that we have to meet each month has been really helpful to making sure that I keep on track with my project. And it has also, I think, it's been helpful not only for this project, but also for learning how to project manage. And I hope that I'll be able to apply that to future projects too, so that I can better juggle my beat reporting alongside larger projects. It's just been really great. I think the other thing too that's been so helpful is having a cohort of other fellows to talk through problems with, to vent with. It has been a really fantastic experience to have this level of support and like camaraderie. Is
Awesome.
there anything else that I can answer? I'm happy to chat about more things too.
Yeah, I was seeing if there's any chats in here about your particular one. I don't see any yet, but we may pay attention to the Q&A and to the chat. If anybody has questions for Emily about what the application experience has been like, what the seminars are like, any sort of details that you want for somebody who has been involved, now is your time to ask. I don't see any at the moment, Emily, but I will flag you if something comes in for you. Awesome. Thank you so very much. Next, we'll chat about our International Health Study Fellowship and that program that comes with that. This is our program where we are able to compare the U.S. health system to its global counterparts. Journalists will travel outside of the United States to produce projects that provide valuable insights that can help inform maybe policy decisions, improve healthcare outcomes in your community, and contribute to the evolution of the healthcare system overall. Um, Eligibility for this one, again, is US-based working journalists who qualify for our AHCJ professional membership. This one, we ask for you to have at least 10 years of experience as a professional journalist, preferably with strong experience covering healthcare policy and healthcare delivery at the national or regional level. We require that you have a current passport that will be valid for up to 6 months after the reporting trip departure date. We want to try and avoid any sort of snafus at the airport by having all of those in place. And then, like I said, our program for this year is specifically focused on UK and France. Our selection process is very similar to that of the US fellowship. We have a committee that reviews each application as it's submitted. Again, rolling submissions are great. The final deadline, though, is September 25th. Our applications will be judged using a matrix of criteria that include our project proposal, the proposed impact of your project, what your experience and qualifications may be, and then what your project sample. I'm sorry, what your project sample is. So next, what's covered by this fellowship? You get training and mentorship. That is a huge aspect of this program. Similar to the US, you get paired up with fellows in the program. You also have mentors who can help you think through your project. You also receive travel to and from New York for the first seminar. You get lodging and meals there. And then you get up to 2 weeks of overseas reporting. So you get travel to the approved country. Your country will be agreed upon with fellowship leaders. You get lodging in that country, reasonable transit, focused on reporting in that country. So we're not looking for you to go explore anything and everything on holiday. but we want to be reasonable that you can get to where you need to go to make your project successful. You get assistance with reporting expenses, and then you also get meal and incidental expenses reimbursed through a stipend. Travel to and from the lodging overseas for the second seminar and a meal and incidental expenses stipend. And then again, you get a year's membership in AHCJ, new or renewed. And we really would love for you to stick around with AHCJ even when you're done. This is the timeline that we're looking at. Like I said, very, very, very similar, almost identical actually to our other timeline for the US fellowship. Again, the deadline is September 25th to apply. Apply early, please, please, please. It will help your chances. October, we're going to start reviewing. November, you will be notified of your status in the program. And then we will announce the classes in December. January, you're going to go to New York. And then spring 2027 is your overseas travel. Let's see here. I'm trying to see. I do not see our international fellow here to talk about her experience, but Catherine or Kelsey, I welcome your input in this. If you have anything you'd like to share specific to the international fellowship and those sort of programming. This is Nicoletta is who we had to speak, but I think we have a schedule issue, and that is okay. So, do either Kelsey or Catherine have anything you'd like to share about international?
Yeah, sure. Happy to talk.
Thanks.
The international program was started just before COVID and then obviously took a break during COVID, and then we brought it back. And we've revamped it in being more inclusive of different countries outside of the UK and outside of Europe. And now we are taking on an approach of moving around to different locations because it's a easier logistical pull for us to have it be more focused and have all of the fellows go more deep in one area versus trying to coordinate logistics for folks in multiple countries at the same time. And that also allows us then to be able to create programming that's more tailored to those projects. So helping connect the journalists with sources on the ground and fixers and that kind of thing. Nicoletta was one of our fellows. Last year, 3 of the fellows were in Japan, and it was a really great experience where they got to do 2 weeks of reporting, and they had worked on getting interviews set up ahead of time, had done a lot of their legwork before going overseas, had fixers and translators on the ground ready to go. And then we also had several days of programming, like I mentioned before, that we put together that had essentially really great sources lined up for them to use as additional resources for their reporting. So that has been kind of how the program has shifted over the last few years, where we're really taking more of a support, even larger of a support role, but still wanting to make sure that you guys have the resources you need to get the color you need for your stories, to get those narratives, to get those interviews scheduled, and to really have that opportunity to do that kind of field reporting that is so rare these days. So, yeah.
Thank you. All right, let's chat application process and tips for your application. We have several questions, and I'm going to bring those all up during our Q&A section. So keep putting those in there. We're going to answer them on air. So application process and tips. One of the first things you need is a project proposal that outlines your topic. And we want you to explain to us why it's a good story for your audience. We want to know about your reporting locations, potential sources, and how the topic is revelatory as a subject. We want you to complete our application form, which is all put together in an Airtable, if you're familiar with that. If not, it's really simple, I promise. The application form will include and require you to submit a 1-sentence overview of your proposal. We want your elevator pitch. We also want your bigger proposal as well, but the elevator pitch is important too. We also want a paragraph on why you're applying for the fellowship, how it will help your professional development. We want a paragraph on the impact that your project will have. Quantitative and qualitative data are awesome. We want a paragraph on your primary audience and the demographic. Where are your readers? Who are they? What are the audiences that you're serving? We would love to have a current resume or a CV. And then we need a letter of support. It says recommendation, it's more a letter of support and a pledge to publish from your employer. Like we mentioned, even if you're a freelancer, we still need you to submit a letter from an assigning editor for an outlet that has agreed to publish or broadcast your final project. That if you don't have that, that's an incomplete application, and we don't actually consider that. So last thing we want is your best work sample published or aired during the last 12 months. We know that some folks are applying as editors, and maybe it's been a little bit longer than 12 months since you've published your own piece. That's okay. We still want to see what work you have available. Tips for a strong application. We really want you to demonstrate your understanding of the topic that you're wanting to cover. Let's not just pick a random topic that you have no background in or no pre-research in. We really want you to be sure that your project pitch reflects the research that you've done and your background on reporting on it. We want you to make sure that your project pitch is as specific as possible, especially if you plan to report on a subject that's been covered deeply already. Our application review committee will want to know what makes your approach a fresh and different one. We also want to know, want you to address directly how you will make the time to be fully engaged in the fellowship. I know that this is one of the questions in the QA. How do you do both? How do you work full time and do a year-long fellowship? We want you to think through that too and ask around. And we can actually, I think they're going to ask Emily to talk about this maybe a little bit soon. But we want to know, how do you plan to make time to be fully engaged? And that includes attending the workshops, your online check-ins, completing the project itself. Tell us how you can handle that. And then lastly, we want you to make a case for why this project in particular is important for your audience, your viewers, your readers, and how people will benefit from that. All right, next we'll talk judging criteria, and I won't go too in depth with these, but basically, this is the matrix that we use to score the projects. We want to know the relevance and the significance. Are you having an original approach to this? What's the potential impact? Does the audience align with the project that you're trying to propose? Do you have enough experience to take on something like this? Is your quality of work up to par? Those are all things that we'll review during our application process. Feel free to take a screenshot of this if you'd like. And then, like I said so many times, I hope you're getting the takeaway. Apply early. We'll review the applications on a rolling basis. The final deadline is September 25th. We're not going to extend that because we are on a tight time frame. So September 25th is what you want. And then I actually just changed this out to be somebody else's name. So Jyoti is on our staff now, and Jyoti is our program manager. If you have questions, this used to go to me, but now we can go to Jyoti, and both of us can answer those questions for you after this discussion. So I am going to stop sharing my screen. I'm going to invite the rest of my coworkers on camera to answer questions that they may see fit. If you have questions, please add them to the Q&A. We are happy to answer them. Oh, yes. I've been asked to go back one slide. There we go. Take a screenshot if you need it, and then we can go from there. I'm going to leave it for 10 more seconds, and then we'll stop sharing. Okay. That was 10-ish, I think. Fabulous. Okay, Emily, the question that is in the chat for you is from Marga. Marga says, "Hello, Emily. Please let us know a little bit more about your time management with the fellowship and your other reporting." And this is a question that we honestly receive a lot. How do we do it all? And so we welcome your input.
Yeah, I think that has varied throughout the course of the project. So at the beginning, when things were a little bit more flexible and I was still just doing a lot of outreach and fewer interviews and reporting trips, I worked less on the project and devoted a larger percentage of my time to my regular beat work. Through most of the year, I would say it was probably 50-50. And then in the last couple of weeks, it's shifted to be like 80/20, 80% project, 20% beat reporting. So that was something that I talked with my editors about ahead of time, like knowing that at some point this project would take up a lot more of my time. And I think the having the fellowship made those conversations a lot easier because there was like a specific, there is a timeline we're supposed to publish this year. And that helped to have some of those conversations. I'm not sure if that was really exactly what they were asking, but that's about how it's worked out for me. I do also think other fellows in my cohort have had a different distribution of time just depending on the project. Mine has ended up being a little bit more travel than I expected, just within Texas, but Texas is a big state, so that has taken up more of my time. And I think other folks didn't end up doing as much travel, so it has definitely varied depending on the project.
Awesome. Thank you so much. Um, oh, looks like Kelsey is answering one question. I'll just go through some of the Q&A that we have received so far. Somebody asked, Shirley asked, are journalists located in U.S. territories eligible for the U.S. fellowship? And it's U.S. Virgin Islands and Puerto Rico are eligible. Additionally, we're looking for journalists who are reporting for U.S.-based audiences. There are questions, like I said, in the application that speak to who your audience is, and what the impact could be on that. Another question from Cecilia. Can one submit more than one application? What kinds of newsrooms are favored? How many applications are selected for U.S. fellowship? Good questions. We encourage folks to submit just one application with one proposal. We select 5 projects, and we select from all sorts of newsrooms. If you go to healthjournalism.org and navigate to this particular fellowship, you can see who our past fellows are, what their projects have been, who they are writing for. We try to have a good mix of newsrooms, a good mix of affiliated and freelance journalists. And yes, Kelsey just put it in the chat. We select 4 projects for international fellowship and 5 for the US fellowship. Another question was, for the international fellowship, do you have to have experience in international reporting? And the answer is no, you do not have to have experience in international reporting, but we do want to see that you have a solid reporting plan so that you're set up for success. That is a big part of this. We do not want you to fail on this, and we're going to do everything we can to make sure that you're set up for success, but that also means you coming to the table, setting yourself up for success too. Somebody says, I have lots of published work, but my reporting has been hindered by unforeseen circumstances in the past 12 months. I feel that. So they have several things that have been, published before that. And we say, submit your most recent and best clips. If you have context for your clips, you can always share that in your application. That is absolutely okay. Let's see. We've got any other stuff? Oh, yay. I did not realize this. This year, our international fellows also get to come to our Health Journalism 2027 conference. Again, East Coast in the spring of 2027. Other questions coming in? We still have time if you have questions to put in there. Um, uh, Anna asks, or Anna, apologies, how does the editing process work? Is our editor the primary project editor, or are we also editing with an AHCJ assigned editor? Catherine, do you want to tackle this, or Kelsey, either one?
Me too.
Oh,
yeah. Oh, go
sorry.
for it, Catherine. You go first.
Your editor is your editor. The way this has worked in the last 5 years that or 4, whatever, 5 years that I've been observing this is that sometimes people reach out to us, the mentors for the projects, for guidance and feedback. Occasionally, a piece of a draft will come our way. But no, your primary editor is your editor. We're there to sort of support, connect, answer questions, sometimes just to affirm your gut instinct. So it's that relationship really doesn't change. There are situations where, people need more because there's been flux in newsrooms right in the middle of projects, a change in editors, a change in the story that naturally occurs when you do reporting. And so that's when we are interacting a lot with fellows to help them sort of navigate those changes.
Yep, we're here for whatever you need, essentially.
And I'll say that was a really great segue. Catherine, there was a question about high turnover with editorial staff and shrinking budgets. Do you have any advice on how freelancers can handle if there's an unexpected issue with the publication following through on their commitment to publish?
We have seen that a lot in the last couple of years, as you might imagine. And what we have done is helped the freelancer try to find a new home for the work, the project, or perhaps even negotiate if we can with the original publication to see if there's a way for them to follow through with their commitment, their well-intended promise to publish the project or broadcast the project. So sometimes we're like the liaison to try to help a person through that upheaval and that uncertainty that has become more common in newsrooms. We have a really good freelancer network. And sometimes I hear myself a lot saying, hey, you should hop into our AHCJ Slack community and talk to people there about, where would you shop this project? I suddenly, it lost its home. And who do you think might be interested? And do you have a connection? And so that's what we remind people about is we sort of facilitate that so that they get through that. And once again, truly, it does happen pretty regularly now, but mostly happy endings, I have to say.
And I just add to kind of piggyback off of that, Catherine mentioned, that network of folks, as part of this, folks get either a new membership in AHCJ or a year renewed. And so, there's all the member benefits that kind of come along with that membership. And a big part of that is the community around it. So it's a huge benefit.
Absolutely. And I will plug that. If you are not in our HCJ Slack community, you should be. You absolutely should be. It's free and there's so many people in there, and you don't have to be a member. We do have some private channels that are just for members, but otherwise, just an open space, and you can do that by going to helpjournalism.org. And as a member of HCJ, you can participate in our mentorship program too, which can allow you to continue working with somebody to help your professional development long after your fellowship is complete. Let's see, any other questions? We got one in here. Are international applicants, oh, it was there. And it's gone.
Sorry.
Okay, Kelsey answered it. Okay. The question was, are international applicants eligible for the application? And just a reminder, this is for US-based journalists writing for US audiences, and our clips need to have been published to submit as work samples. Trisha asks, I imagine it would be easier to get a story placed as a freelancer if the reporting expenses are guaranteed to be covered up to the $2,500 from AHCJ. Would a soft commitment from a publication suffice for the application, or does it have to be a guarantee that they will take on the story? It has to be a guarantee.
Yeah, we're looking for placement. I mean, part of what we look at is the audience and the impact of the reporting. And so if we don't know where the story is going to land, we cannot accurately, judge the proposal essentially, because we don't know who the audience is for that piece.
Okay. Are there other questions? Any words of wisdom that AHCJ staff want to impart on our hopeful applicants? Now is the time we could do that. Oh, good. Can an applicant apply for other funding from another grantee or fellowship program to support his or her work?
I have not seen this come across before. My initial gut would say likely no, given that we have certain requirements. But I don't know. I'd have to kind of go back and look at our grant proposal and to look at that. And if folks have questions, please put them in the Q&A. Yeah, I saw someone raise their hand, so please put them in the Q&A. But yeah, I'm not sure I could answer that question. I would need to do some more digging.
Good question.
There are reporting costs associated with, or reporting budget associated with
stipend.
Yeah, stipend for the fellowship. So we do have line items available to help support those costs.
which absolutely could be used for FOIA fees.
Yeah.
And probably has.
Yes.
Other questions? We're at your disposal. Again, application deadline is September 25th. You can go to healthjournalism.org, look at all the previous program fellows that we've had, what their projects were, where they are now, that sort of thing. And honestly, I bet you that most of those fellows are would be receptive to folks reaching out to ask them about the program and their experience in that. So if that is you and you have a desire to be connected with somebody, reach out to us. We're happy to play connector for you. Thank you, Kelsey. Yes, all of our opportunities, healthjournalism.org/fellowships. Easy peasy.
Please reach out if you've got questions, and we look forward to seeing your proposals.
All right. Well, if there's nobody dropping in any more questions, we'll end early and give you 23 minutes of your day back. So thank you all so much for being here. We can't wait to see your applications and the impact that you're going to have on the health journalism space. Have a great day, and we'll see you on the internet.